So actually what's an embolism? Embolism is an intravascular solid, liquid or gas. This is important. A thrombus is always a solid, but the emboli can be a solid, liquid or gas mass, and it is carried by the blood to a side distance from its point. So it is moving away from the source of its point. Mainly, for example, you can take pulmonary embolism, in which the main source is from deep vein thrombosis. That is from the legs of our deep vein thrombosis. It travels through our blood into inferior vena cava, thereby reaching our right atrium and right ventricle, and next going into pulmonary artery. So this is an example. So first let us see the concept behind this. So the phenomena occur in the circulating blood with the insoluble abnormal substance clogging the blood vessel with the flow of a blood is called embolism. So blocking the vascular abnormalities substance is called as embolus. So embolus is intravascular, may be solid, liquid or gas that is carried by the blood to a side distance from its point of origin. So based on this is divided into based on the circulation way of an embolus and the type of embolism and its effect on the body. So based on circulation way of embolus, the pathway generally consistent with the direction of blood flow, that is classified into anterograde embolism, crossed embolism, retrograde. So anterograde embolism is it is in the flow of our blood, that is moving in the flow of blood flow, and the crossed embolism is called as paradoxical embolism, in which the embolus travels from the venous side of the heart to the venous side of a circulation to the atrial side of a circulation and vice versa. This is because of any septal defects or maybe because of any other defects. So this is known as paradoxical. Because of this cross embolism, it also goes into the systemic circulation, that is towards the arterial side. And next coming to retrograde embolism. Retrograde embolism means the movement of flow of blood is in opposite direction to our blood flow. So this is known as retrograde embolism. So now let us see about the categories of embolism. So first we need to know the basic that the term embolism is given by Rudolf Virchow. It's nothing but saying this: there is lodge in the blood vessels which are obstructing the flow of blood, and most of the forms of embolism is known as thromboembolism, because most of them is because of the dislodgement of the thrombus. That is, as the thrombus is dislodged from the vessels only, it is forming the emboli. Emboli means nothing but movement into other places. So the rare forms of embolism are like fat embolism and nitrogen bubbles, atherosclerotic debris, tumor fragments, bone marrow, or even some foreign bodies. So these are the more rare kinds of embolism. And here you can see and one more thing, this emboli can lodge in any place of our vascular system. So it's divided into thromboembolism, it's 99%, that is almost everything is from thrombus. And next air embolism, formation of gas bubbles, and amniotic fluid embolism, that is fluid embolism, fat embolism, and also other embolisms may be in the parasite, tumor cells, etc. So first let us understand about pulmonary embolism. So this pulmonary embolism is mainly in patients who are undergone surgery, pregnancy, malignancy. So all these have high risk to get this. 95% of the cases are mainly from the deep vein thrombosis, that is DVTs. So the fragments from this DVTs are carried by larger channels towards the right side of the heart into the pulmonary arterial vasculature. So when it is moving through the vasculature, here you can see when it is passing through our pulmonary artery, as pulmonary arteries bifurcated into further pulmonary arteries. So when at this bifurcation, if it gets stuck, then this is known as saddle embolus. Or if the embolus is so small so that it can pass through this bifurcation, then it is normal embolus. But whenever it is big embolus, then it gets stuck here and forms a horseshoe shape known as saddle. So you can see this saddle. And frequently there are formation of multiple emboli from the larger emboli, because that larger emboli may also get fragmented, and the patients who are undergone this pulmonary embolism at one time may have high risk of getting this embolism again. So they should be careful. And rarely this embolus can also pass through interarterial or interventricular defect. So that was we had discussed, that is paradoxical embolism or crossed embolism, where sometimes because of interventricular defect or interarterial defect from the venous side is also enters into atrial side and going into systemic circulation. So most of this pulmonary emboli, that is 60 to 80%, are clinically silent because they're small. You can see it is very big, so then we can understand there is a saddle shape. But most of these emboli are silent, and they also reorganize, that is they organize into the vascular wall and become again normal and leaving behind some fibrous web. So we can understand by that, oh, there was before a small emboli. And also sudden death and right heart failure may also take place, that is known as cor pulmonale, if it is not treated or not observed rapidly. So this is also leading to cardiovascular collapse, and emboli obstruct about 60% or more of the pulmonary circulation when it is a big emboli. And next, embolic obstruction of medium size arteries could lead into pulmonary hemorrhage but not into pulmonary infarction. This is important. Why pulmonary hemorrhage? Because if you remember, lungs has dual supply of blood from both intact bronchial circulation and so that the perfusion never gets less, so there is no chance of development of infarct, but there is a development of hemorrhage in the medium sized arteries. And however, the similar embolus setting of the left sided cardiac failure and because of compromised bronchial artery outfit, then it results in the infarction, because as the dual supply nature is decreased, and now as it becomes like a small end arteriolar system, then it converts into an infarct. And the multiple emboli over the time may also cause the pulmonary hypertension and the right ventricular failure. Why right ventricular failure? Because this emboli from the leg first enters into the inferior vena cava, then into right atrium and right ventricle. So this is the main place it may also get damage. So this is all about pulmonary embolism. Here you can see 80% of emboli come from the left heart. This is about systemic. Okay, now next let us see the systemic arterial embolism. So the systemic arterial embolism, the 80% of the emboli come from the left heart. The consequences of embolization depend on the local artery supply. The lesion occur mostly in the lower extremities, brain, kidney, intestine, spleen, and upper limbs, and also liver are the less common targets. So the thromboembolism taking place in the systemic means towards the left side of arteries. So this is mainly because of intracardial mural thrombi, or 2/3 are also associated with left ventricular wall infarcts, that is the left atrial dilation and fibrillations may be cause for this, and also aortic aneurysms and thrombus of atherosclerotic plaques, ulcerated forms, and also fragments of the valvular vegetations of the heart. So actually what happens, these small fractions parts, they just entered into the left, because at the site only they form the embolism. And also it may be due to paradoxical embolism, that is same from the venous side to arterial side they may travel. And this systemic emboli, some of them 10 to 15% are unknown origins, still we don't know from where they are coming. And in contrast, actually this venous emboli also tend to lodge primarily in the vascular bed of the lung, that is the arterial emboli can travel to wide variety of sites. As arterial emboli can travel to wide variety of sites, it's most dangerous than venous emboli, because venous emboli is mainly traveling towards lung. So arteries emboli is somewhat difficult, and it also depends on the relative amount of blood flow that the downstream tissues receive. And the major sites of this arterial embolization are the lower extremities, and also brain, intestine, kidney, spleen, and upper extremities involved to a lesser extent, mainly the lower extremities. And the consequence of this embolization in a tissue depends mainly on the vulnerability to ischemia, because as there is low blood supply, it is more risk to form a greater emboli, and the caliber of occluded vessel, and also whether there is a collateral blood supply or not, because if there is collateral blood supply, then there is less chance to form. And in general, this arterial emboli cause the infarction of the affected tissues too in a localized area. And next let us see the fat embolism. Here you can see how the fat globules are formed. So these fat globules are the microscopic globules associated with the hemopoietic marrow elements, and they are found in circulation and impact in the pulmonary vasculature after the fractures of mainly long bones, because the long bones have most of the fatty marrow. So when this fatty marrow release into the circulation, they form this fat emboli. and they are like also seen in the soft tissue trauma and burns, and also fat associated cell release by marrow or adipose tissue injury. So these enter the circulation after the rupture of the marrow, vascular sinusoids, and also venules. So this fat and marrow PEs, that is pulmonary emboli, are very common findings after the vigorous cardiopulmonary resuscitation, because this fat emboli have a more chance to reach the pulmonary side, that is towards the lungs. And also this fat emboli, some in the 90% of the individuals have with the severe risk of traumatic cases, that is severe skeletal injuries, they are having a higher risk, and less than 10% of patients have any clinical findings. So this fat embolism syndrome is also termed to apply the minority of patients who become symptomatic. And also the pulmonary insufficiency, so this, it may be having some symptoms like pulmonary insufficiency, neurological symptoms, anemia, thrombocytopenia, and 1 to 3 days after the injury there may be sudden onset of tachypnea, dyspnea, tachycardia, and also sometimes leading to coma. So the thrombocytopenia is nothing but attributed to the platelet adhesion to the flat globules, and also aggregations or splenic sequestration. So anemia can result from similar red cell aggregation or also hemolysis. So how we can find out this is by a petechial rash. So by finding this rash we can understand there is related something to thrombocytopenia, and it can be useful to find out this fat embolism. And it's coming to the pathogenesis of this. It involves mainly mechanical obstruction and biochemical injury. That is, this fat microemboli are mainly associated with the red cells, platelet aggregates, and also they occlude the pulmonary and cerebral microvasculature. So they mainly occlude the pulmonary and cerebral. So we can find this fat emboli mainly in the lungs and cerebrum. So this release of free fatty acid from the fat globules in the situation causing a local toxic injury to the endothelium, and also thereby activating the platelets, granulocyte recruitment with free radical proteases, and this complete vascular assault. So because lipids are dissolved out of tissue preparation by solvents, routinely it is used in paraffin embedding. So that process we use for this in microscopical techniques to find out this is, we use frozen sections and stains for the fat. So you can see, so we are using a osmium stain and we are using the He stain. So we need the stain to observe it clearly. And next, coming to the air embolism, you can see how an air bubbles are formed in the vessels. This is mainly because of the gas bubbles within the circulation. So these gas bubbles may be trapped in the coronary artery during a bypass surgery, or also in cerebral circulation by a neurosurgery in a sitting position, and also may occlude during mainly because of 100 cc of the air capacity and in the pulmonary circulation. So however, this volume of air is introduced during obstetric or laparoscopic procedures or a consequence of chest wall injury. So during certain operations or also during intravascular injections, we need to be careful that there is no formation of air bubbles. So if it is of 100 cc, then it is going to affect mainly lungs. And this particular form of gas embolism is mainly due to the decompression sickness. So what is this decompression sickness? It is mainly seen in scuba, deep sea divers, and underwater construction workers. So what happens is, as these persons are moving from very high pressure atmosphere to low pressure atmosphere or normal atmospheric pressure, there is a change in the atmospheric pressure. This leads to a rapid nitrogen bubble, that when this person gets out into normal atmosphere, then there is rapid influx of nitrogen or many other gases. So this dissolve in that body and lead to a deep pressure condition, that is decompression sickness. So the nitrogen comes out the solution in the tissues and the blood. So the rapid formation of gas bubbles within the skeletal muscles and the supporting tissue and joints also responsible. In the joints there is a painful condition when this takes place. This is known as bends. And in the lung, these gas bubbles also cause edema, hemorrhage, and focal epistaxis, emphysema. So this stress in the lungs is known as chokes. And the more chronic form of this is known as Cassian's disease. So this is mainly seen in the pressurized vessels used in bridge construction workers. So this Cassian is nothing but is a bridge tube which is used to construct the bridge in underground water or any underground workers. So here we can see this. It's so these people also, when they come into normal atmosphere, they're forming a gas emboli at them, and also leads to multiple foci of ischemic necrosis, and more common sites are femoral heads, tibia and humerus. So the acute decompression sickness is mainly treated by placing the individual in a high pressure chamber, which serves to force the gas bubble back into solution. So this is a treatment. So the subsequent slow decompression theoretically permits gradual reabsorption and exhalation of gases, so that these obstructive bubbles, they do not form again. So this leads to treatment, that is again normal condition. And next, coming to amniotic fluid embolism. So this is mainly seen in a labor immediate postpartum, or also seen in newly childbearing mom. So where what happens is, it's making the amniotic fluid embolism is the fifth more common cause of maternal mortality worldwide. So it may also lead to permanent neurological defect in 85% of survivors. So even if they survive, they may have neurological defects, and this onset by a sudden severe dyspnea, cyanosis, shock, followed by neurological impairment, that is headache, seizures and also coma. So the patients survive in the initial crisis, but the pulmonary edema typically develops, and also in half of the patient leading to DIC. So as a result of all this, there is a release of thrombogenic substance from the amniotic fluid. So what is the main cause of this amniotic fluid embolism is, that is mainly because of infusion of amniotic fluid or fetal tissue into the maternal circulation. So as this amniotic fluid is entering into the circulation, it is leading to rupture of tear in the, as there is already tear in the placental membrane, or rupture of uterine veins. So this classical findings include the presence of squamous cells shed from the fetal skin, longo hair, fat from vernix-ciosa, and also mucin derived from the fetal respiratory or gastrointestinal tract in the maternal pulmonary microvasculature. So all this is present in the maternal circulation because of tear between or any damage to the umbilical veins. So all this enters into the maternal circulation and leading to severe defects. So other findings like include marked pulmonary edema and diffuse alveolar damage. So all this, and also presence of fibrin thrombi in many vascular beds due to DIC. So these are all present in the amniotic fluid embolism. So there are also other embolisms like tumor embolism, bacterial embolism. You can see pictures. So tumor cell embolism may cause metastasis, and the bacterial flora and parasite enter the blood can also cause embolism. So this is all about embolism.